What is diabetes? Diabetes mellitus, commonly known as diabetes, is a metabolic disease that causes high blood sugar. Blood sugar is also called blood glucose. It is your main source of energy and comes from the food you eat. So diabetes affects how your body turns food into energy. Cause of diabetes. Insulin is a hormone made by the organ pancreas. Insulin helps glucose broken down from food and released into your bloodstream get into your cells to be used for energy. With diabetes, your body either doesn't make enough insulin or can't effectively use the insulin it does make. Glucose then stays in your blood and doesn't reach your cells, causing blood sugar to rise. Impact of diabetes. Over time, having too much glucose in your blood can cause health problems. Although diabetes has no cure, you can take steps to manage your diabetes and stay healthy. Types of diabetes. The most common types of diabetes are type 1, type 2, and gestational diabetes. Type 1 diabetes. If you have type 1 diabetes, your body does not make insulin. Your immune system attacks and destroys the cells in your pancreas that make insulin. Type 1 diabetes is usually diagnosed in children and young adults, although it can appear at any age. People with type 1 diabetes need to take insulin every day to stay alive. Type 2 diabetes. If you have type 2 diabetes, your body does not make or use insulin well. You can develop type 2 diabetes at any age, even during childhood. However, this type of diabetes occurs most often in middle-aged and older people. Type 2 is the most common type of diabetes, account for over 90% of diabetes cases. Gestational diabetes. Gestational diabetes develops in some women when they are pregnant. Most of the time, this type of diabetes goes away after the baby is born. However, if you've had gestational diabetes, you have a greater chance of developing type 2 diabetes later in life. Sometimes diabetes diagnosed during pregnancy is actually type 2 diabetes. Other types of diabetes. Less common types include monogenic diabetes, which is an inherited form of diabetes, and cystic fibrosis-related diabetes. How common is diabetes? About 10% of the population in the United States has diabetes. More than 1 in 4 of them didn't know they had the disease. Diabetes affects 1 in 4 people over the age of 65. Over 90% of cases in adults are type 2 diabetes. Who can get type 2 diabetes? You are more likely to develop type 2 diabetes if you are age 45 or older, have a family history of diabetes, or are overweight. Physical inactivity, race, and certain health problems such as high blood pressure also affect your chance of developing type 2 diabetes. You are also more likely to develop type 2 diabetes if you have prediabetes or had gestational diabetes when you were pregnant. Prediabetes. In the United States, more than 1/3 of population have prediabetes. What's more than 8 in 10 of them don't know they have it. With prediabetes, blood sugar levels are higher than normal, but not high enough yet to be diagnosed as type 2 diabetes. Prediabetes raises your risk for type 2 diabetes, heart disease, and stroke. Symptoms. Diabetes symptoms vary depending on how much your blood sugar is elevated. Some people, especially those with prediabetes or type 2 diabetes, may sometimes not experience symptoms. In type 1 diabetes, symptoms tend to come on quickly and be more severe. Some of the signs and symptoms of type 1 diabetes and type 2 diabetes are increased thirst, frequent urination, extreme hunger, unexplained weight loss, presence of ketones in the urine, fatigue, irritability, blurred vision, slow healing sores, and frequent infections such as gums or skin infections and vaginal infections. Type 1 diabetes can develop at any age, though it often appears during childhood or adolescence. Type 2 diabetes, the more common type, can develop at any age, though it's more common in people older than 40. Health problems from diabetes. Over time, High blood glucose leads to problems such as heart disease, stroke, kidney disease, eye problems, dental disease, nerve damage, and foot problems. How to manage diabetes? Losing weight, eating healthy food, and being active can really help. Recommended foods. Make your calories count with these nutritious foods. Choose healthy carbohydrates, fiber-rich foods, fish, and good fats. Healthy carbohydrates. During digestion, sugars, simple carbohydrates, and starches, complex carbohydrates, break down into blood glucose. Focus on healthy carbohydrates, such as fruits, vegetables, whole grains, legumes, such as beans and peas, low-fat dairy products, such as milk and cheese. Avoid less healthy carbohydrates, such as foods or drinks with added fats, sugars and sodium. Fiber-rich foods. Dietary fiber includes all parts of plant foods that your body can't digest or absorb. Fiber moderates how your body digests and helps control blood sugar levels. Foods high in fiber include vegetables, fruits, nuts, legumes, such as beans and peas, and whole grains. Fish. Eat heart-healthy fish at least twice a week. Fish such as salmon, mackerel, tuna, and sardines are rich in omega-3 fatty acids, which may prevent heart disease. Avoid fried fish and fish with high levels of mercury, such as king mackerel. Good fats. Foods containing monounsaturated and polyunsaturated fats can help lower your cholesterol levels. These include avocados, nuts, canola, olive, and peanut oils. But don't overdo it, as all fats are high in calories. Foods to avoid. Diabetes increases your risk of heart disease and stroke by accelerating the development of clogged and hardened arteries. Foods containing the following can work against your goal of a heart-healthy diet. Saturated fats. Avoid high-fat dairy products and animal proteins such as butter, beef, hot dogs, sausage, and bacon. Also limit coconut and palm kernel oils. Trans fats. Avoid trans fats found in processed snacks, baked goods, shortening and stick margarines. Cholesterol. Cholesterol sources include high-fat dairy products and high-fat animal proteins, egg yolks, liver, and other organ meats. Aim for no more than 200 mg, mg, of cholesterol a day. Sodium. Aim for less than 2,300 mg of sodium a day. The plate method. The American Diabetes Association offers a simple method of meal planning. Basically, it focuses on eating more vegetables. Follow these steps when preparing your plate. Fill half of your plate with non-starchy vegetables, such as spinach, carrots, and tomatoes. Fill a quarter of your plate with a protein, such as tuna, lean pork, or chicken. Fill the last quarter with a whole grain item, such as brown rice, or a starchy vegetable, such as green peas. Include good fats such as nuts or avocados in small amounts. Add a serving of fruit or dairy in a drink of water or unsweetened tea or coffee. Counting carbohydrates. Because carbohydrates break down into glucose, they have the greatest impact on your blood glucose level. To help control your blood sugar, you may need to learn to calculate the amount of carbohydrates you are eating so that you can adjust a dose of insulin accordingly. It's important to keep track of the amount of carbohydrates in each meal or snack. Summary. Your family, environment, and pre-existing medical conditions can all affect your odds of developing diabetes. Diabetes is a very common and serious long-term disease, but most don't know they have it. Although diabetes has no cure, you can take steps to manage your diabetes and stay healthy. Health is very important to everyone. Don't let other activities consume all of your time and energy. Proper awareness and attention to early signs of abnormal symptoms are keys to keep us healthy. Early treatment is always more effective than late emergency actions. May you stay healthy and have abundant of happy life. Please like and subscribe this channel for more health-related videos. Thank you.